What does AI in medicine look like now, and where might it go in the future? My name is Dr. Ruth Otten. I'm a board certified adult psychiatrist, and I've gotten lots of messages and requests to talk about this topic, so let's talk about it. So we all know that AI is coming fast and furious. Definitely over the last couple of years, I've seen it grow so much, and it's probably the next biggest thing. Just like the internet, next thing we know, it's going to completely change how we do everything. So we kind of have to get on board or jump off the ship. So let me tell you how we're using it right now, at least in my experience. And I'm a mental health provider, so this definitely is going to look different across the disciplines. So one, we use it for documentation. So I will use an AI scribe to help me with my note. Now it can pretty much generate most, if not all of your note, including reporting what the patient has said, physical findings or recent lab findings, etc., and even formulating a plan. Additionally, we can use it to summarize the medical record, so it can look through a patient's chart and then give you a summary of whatever it is that you're interested in. And of course, in mental health, there are the chat boxes, right? So we have AI therapist chat boxes, and there's a lot of mixed feedback on those. They certainly can be helpful when someone needs quick access to someone. However, there have also been some really misguided situations where AI chatbox therapists have told people to do very dangerous things, raising questions about the safety of using them in this capacity. Now, where could AI go in the future? I really think the sky is the limit. It's hard to predict, but some of the things that people are talking about are certainly more in diagnosis, processing all of the available information and then giving out the most likely diagnosis. That certainly makes me a little bit nervous because there's certainly so many nuances that go into why I may make a diagnosis that I do, especially in mental health. It's probably going to be used more and more for the what we call scut work in medicine, right? So example one, note writing. Other things could include routine anticipatory guidelines and other routine care, things like counseling people about sleep hygiene, although this is very important and I think should be individualized, or seatbelt safety, or counseling about diet and exercise. Although again, I do think this should be individualized. But I think that where I see AI being the most beneficial is by helping to increase access to care. Because right now, primary care providers and advanced practice practitioners are doing all of this scut work that might be able to be done by AI, which would allow them to see the more acute and high need patients who need more complex care. Similarly with specialists. Right now, if you need to see a neurologist, you may have to wait for 3 months, 4 months, 5 months, 6 months to see a neurologist. But if we have AI being able to triage which cases are pretty straightforward and can get straightforward interventions and which ones need a more specialized assessment, then that could really help with improving how bogged down a lot of our systems are. So I'll stop it there. I think there are so many different ways that this could look, but if you're using AI in a medical field in some other capacity, I'd love to hear about it. So please share in the comments below. Or if you have ideas for what it might look like in the future, share that too. If you're interested in getting more direct resources and content from myself, then I do have an email list going and I send out bi-weekly emails. So if that's you, then send me a DM with your email and I'll see you in the next one.